Yeah, then I'll make a start. Welcome to everyone who managed to join. We do expect a few more people because quite a few people did sign up, which is great to see that there's interest in our TWG. And I will start with a very brief introduction for those of you who may be a bit new to our thematic working group, to give us the background on what we want to do. And then later on, we'll give the floor to Maria, who will tell you a bit more about our previous things we did and our plans in particular for the future. And I think the emphasis is on, please, if you listen, think about how you can somehow, if you want to talk, if you want to engage somehow. There are opportunities. It's not so easy to communicate always with members. So this is a great opportunity for us to do so. We hope that you can engage, and we have at the end of the session we have a bit more formal Q&A question, and if you want you can also speak up if you raise your hand. Otherwise you can post your messages in the Q&A box. Yeah, I think Maria just asked you to introduce yourself in the Q&A box. I think that's a good thing to do. But let's start with the talking while you do this. So this is our small agenda. Give you this brief overview of our TWG recent activities and achievements. And then we have a map of our members, which we recently managed to complete, which for us, it was quite an eye-opener. So I hope for you as well to see that map, to see where you are. And yeah, it seems you are all over the world. And then we look at planning towards HSR 2024, which stands for the next Health Systems Global Symposium, which will be held in Nagasaki in Japan in November 2024. And then we'll end up with some more Q&A. Yeah, do you have the next slide, Maria? And then the next one. Yes, this is our old photograph taken in very long ago at a roundabout in Juba. But this is also what we still use, and this is how we announced on the HSG website, and it briefly explains what our TWG, the Thematic Working Group on Health Systems in Fragile and Conflict-Affected Settings, this mouthful, as we call ourselves, is about. Yes, next please. So yeah, we have an increasingly quite rapidly increasing membership over the last year, which is very good to know, and of course calls upon us as the steering committee to ensure that we can connect with you, that we have your input, and so this is one of the means we want to achieve this. So we have more than 2,000 members. In that sense, we're by far the largest thematic working group under the Health Systems Global, and we try to engage with researchers, policymakers, donors, practitioners, health managers, providers, educators, civil society, private sector, and beneficiaries. And of course, some of you are more in one of the categories than others, and you will see on the members mapping some idea of what members do represent. So what we want to do, we want to connect and network, and I hope at least that you are also receive our newsletter, which we have done over the past 2 years. I think that's a great tool to connect you, all of us, a bit better. And we encourage you to read the letters and see if there's any way that you can contribute or otherwise can engage. So we try to share knowledge, information about health systems issues in fragile states or settings, and the advocacy, that's definitely there. The capacity strengthening, that is an objective, but that's still a difficult one to actually do. Next, please. Yes. So I was already talking about a steering committee. So Health Systems Global, as you may know, has 10 thematic working groups. So they, for some, they are the core of the Health System Global, next to the biannual big symposium which they are organizing. And each thematic work group has a slightly different way of organizing themselves. We have a double way of governing our thematic group, also reflecting that we have quite a big size. And this is our steering committee, so kind of day-to-day management of the thematic working group. So apart from myself, Egbert Zonder, we have Maria Bertone, who you already have seen. She sits in Edinburgh in her day-to-day life. We have Sharon Lowe, who lives in Singapore. We have Ali Adalan, who works with Emro, and he is living in Cairo. And we have Barbara Profeta, who was still, some time ago, she was living in Niger, but had to relocate to Zurich. Yes, please. So our second layer of our governance structure is an advisory group. This is a group of people, some old hands who used to be in the steering committee, but also increasingly some new people. We try to identify people and encourage people to join, to have some, in particular, some geographical diversity. And these are the members who are currently members of the steering committee, of the advisory committee. There's Mohammed Ali, Anne Canavan, Harry Coleman, Steve Commons, Andre Griekspoor, Amina Mahmoud, Sumit Mazumdar, Nigel Pearson, and Irene Torres. Yes? So this is the way we try to communicate. We have always banked on LinkedIn, and if you have signed up for our thematic group, you probably have been using a LinkedIn. LinkedIn is a bit difficult to do two-way communication, so we also have opened a group account, a Google group account, which you use, and part of members have also signed up for that. It's a bit more immediate means of communication. It's also easier to get you the newsletter and other news. And then, of course, there is a website which is hosted by the Health Systems Global. And I think now I can give the floor to Maria to update you on our current activities and achievements. Maria.
Thank you, Egbert, and thanks everybody for introducing yourselves on the chat box. We will try to keep monitoring that if you have any questions or any thoughts. But I think since it's not many of us, the best, as Egbert said, it will be to have a bit of a chat, question and answer, but really kind of discussions at the end. So I'm going to go over the recent achievements and activities of the TWG-FCAS. So 2 years ago, 2021, we had the HSG launch a competitive refresh for the TWGs. As Egbert said, there are 10, and there was a renewal of them. So we had to kind of bid, in a sense, prepare a proposal and justify the rationale and our work. And indeed, the TWG-FCAS was confirmed for the next 4 years, so until the end of 2024. So our time frame for this cycle, in a sense, is until the next refresh just after Nagasaki 2024. And this is now the time, and perhaps this meeting is a good occasion to start thinking about that, to start thinking about how we want to plan the next cycle, and also in terms of changing leadership, in terms of steering committee and also advisory committee. So this is for information for the members. We will definitely have more sessions on that, and also reflect on this in Nagasaki for those who will participate. In these, since the refresh, we've been focusing on improving regional representation, as Egbert mentioned, trying to renew our advisory committee in this sense, but also we've focused on communication with the recruitment of a communication coordinator and the launch of a newsletter, which hopefully is something helpful and useful for our members. And we want to engage the members as much as possible, and it's great that you are here today, and also make the TWG-FCAS visible and the work relevant for you. In the past 2 years, we focused on two main themes that were, sorry, I have to go back one slide, that were the health systems in governance, the governance of health systems in fragile setting. And then obviously at that time, very relevant, the impact of COVID-19 in fragile and conflict affected settings. So for those first 2 years of the cycle, we had a series of webinars and blogs looking at those two issues. And now for this kind of last year and a half that we have in front of us, we're planning a new activities that I'm going to go over in a second. So if we look back at the last 2 years, what we've done, it's quite a rich list of activities, as I mentioned, blogs and webinars, working on those two themes, but also on other kind of ad hoc and specific topic that emerged. We have we had webinars jointly with WHO on health financing in fragile and conflict affected settings, both in French and in English. And we had all these activities that you can see here. And hopefully you will have slides available and all the hyperlinks to look back at the blogs and the webinars. It's interesting to note that our membership in these last 2 years has gone up on LinkedIn from 1,300 members to more than 2,000 when we checked when we did the mapping in June. So that's quite an impressive increase. And also, as Egbert was mentioning, we did some work in terms of finalizing our SOPs and the governance structure, and making sure that we had regular meetings and as we said, the recruitment of a comms coordinator and the launch of a newsletter. So this is just to give you an overview of the last 2 years, but something that we found very interesting that we've done recently is the member mapping. We always had this sense that obviously we have a lot of members, but because of how LinkedIn is organized, it's really difficult to know who they are and what they do. And in the past, we've tried to run surveys of our membership, but the response rate is really low. So in the end, we knew about a few that we often engage with, but we didn't have an overview of the broad membership. But luckily, because of the technical skills of some people in our steering committee, Sharon in particular, and Harry in the advisory group, they were able to come up with a system to scrape data off LinkedIn. Didn't know it was possible, but apparently it is, and it's quite interesting. It gets information that obviously needs a lot of cleaning, but information from LinkedIn of all the variables, all the information that it's published there. So we did that for a total of a bit more than 2,000 members. And what we focused on, because of the limited time we have, was in terms of their geographical mapping and the profession. And this is the outcome, excuse me, this is the outcome of the mapping. So first of all, you can see in the map of the word how spread is our TWG, the reach of our TWG. We have about 2,000 members, and 14% is based in the UK, and 13% is based in the US. So that is for a total of 27% of the members, but the remaining 73% is spread all over 127 countries. So we have 129 countries represented. Obviously, it comes from LinkedIn, and sometimes it might be the place where people work, or sometimes it might be the place where people are from. So there might be some issues there, but in general, it means that the expertise and the knowledge that the TWG covers in terms of geographical spread is quite wide, and that is really great for us to know and to see that the TWG represents so many countries. And then on the right-hand side, you can see the profession. The top category is excuse me again, is academic and researchers. And that is about 24% of the total of TWG members. And then international organization represents 17%, and providers or Ministry of Health or other organization is about 15%, and then others are a bit less. So again, this tells us quite a lot about our members. Obviously, there's a lot of researchers like myself and Egbert who are interested in obviously pursuing this agenda of doing research and understanding better health systems in fragile and conflict-affected settings. But there is also a lot of members who work within international organization, and also again represented in our steering committee like Ali and Barbara, but broadly also in the membership. And also other members who are practitioners in the field, whether they work for a Ministry of Health or for a health service providing organization and so on. So it's interesting to see the diversity in our membership, and it's important for us to try and reflect that in the activities that we do. And therefore it's great to have you here today to also hear your views about what we should do and how. Sorry. struggling to move to the next slide. Okay, so the planning for the next year and a half or so towards HSR 2024. Obviously, we want to continue and improve our communication activities, and with in mind this idea of trying to engage as much as possible the members. So this member mapping, hopefully it's the first step in the right direction, and the members meeting that we're having now, another one. So we also have, as you probably know, the bi-monthly newsletter that is available on the TWG-FCAS page on internet, but also via Google and the LinkedIn groups. We also want to keep engaging in the relevant fora in order to advance the health system in FCAS agenda. So this is in terms of talking to our advocacy objective. So between us in the steering committee and members, we are engaged in, obviously, in Health System Global, but also in the UHC 2030 group, with the Alliance for Global Health, with the Global Alliance for War, Conflict and Health. And we are, in fact, one of the founding members for that. And we are engaged with research consortia and centers, such as the Rebuild for Resilience Consortiums and the KIDS Center for Health Systems in Fragile and Conflict-Affected Settings. If you have other ideas or suggestions of fora that are relevant for our work and that you think we should engage in terms of advocacy and dissemination of information, please do let us know. That's something important for us. And then the last, and obviously the most important activity for us, is the knowledge sharing activities. For this second biennia, which is now almost only a year, we're going to focus on 3 core topics, and we also have launched a webinar series. So in terms of a webinar series, we have recently launched that. It's called the Talking Points webinar series, and we already had one webinar in August on the health system recovery and reconstruction in Ukraine in collaboration with HSG Europe. We're thinking of new webinars, so in particular on Afghanistan, looking at the health system in Afghanistan over time. We're thinking of one on human resources for health in fragile and conflict-affected settings, and we had great suggestions from a member from Ecuador. We're also thinking about a webinar on climate change and FCAS. But if you have other topics, ideas, suggestions, you want to share your work or a report you've been working on, or your either kind of practice or academic research, we're very happy to take suggestions. So you have the link here, and you can fill in the form or contact us directly with your ideas, and it will be amazing for us to try and help you organize the webinar, put you in touch with others, maybe to give a kind of a global perspective to what you present, and support you in sharing your work and your knowledge. So this is one activity. And then the other kind of core activities is looking at these 3 specific themes. And for this, we're trying to be very pragmatic and give ourselves a clear set of deliverables that we want to achieve by the time we meet in Nagasaki in November 2024. So the 3 themes, the first of the 3 themes, it's on fragility, the concept, which is obviously very debated. We have the term fragility in our own title for the TWG, this kind of FCAS kind of label. And we know it has been debated and contested multiple times. So we want to reflect on this and try to bring different views and perspective on the label fragile, and reflect on what it means and what it means for the health system. So Egbert will lead this group, and again, if you're particularly interested in this topic, let him know, let us know, and we would try to, by the time of Nagasaki conference, we were aimed to have a commentary or a paper and a webinar on this. The second theme that we're thinking of, it's quite topical, and it links to our successful session at HSR 2022 in Bogota, and it's that of a healthcare response for refugees and migrants and the integration in national health systems. So with support from Irene, we're working together on this, and we're trying to prepare a blog post kind of detailing a little bit the challenges and the debates. And from that, the idea is to start another series of webinars, a few webinars focusing on the work that many of us and many around the world are doing on the healthcare response for refugees and migrants and the integration in national health system. And again, any suggestion, if you're working on this topic, if you're interested to share ideas or get connected to networks of people working on this topic, we're very happy to help you. So reach out to us with the idea of having an organized session at HSR. So the final topic we're working on is on health system strengthening in FCAS. And this is both in terms of knowledge dissemination and also advocacy. There has been recent work on what is health system strengthening in general and specifically in FCAS and how can we promote that. So we want to try and kind of support that work and contribute to it by developing something theoretical, perhaps bringing together a working group working on the principles of health system strengthening in FCAS. And if you're interested in joining this, please email me or the FCAS general email to get in touch. But we also would like to have a very participative component. For example, using photo voice or storytelling to have examples and perspective from the field. So hopefully this will lead to a multimedia session at HSR 2024. So these are our plans, and thank you very much for listening. Very ambitious, I think, but hopefully leading to very concrete outputs and also relevant for our members and interesting to put together and to carry out. So I will stop here and we can open the floor for discussion. And again, looking forward to hear what you think of this and how you think this talks to your work and your contribution to the TWG, but also how we can support each other on this agenda. Thank you very much. Back to you, Egbert.
Yeah, thanks a lot, Maria, for this overview. So I think, yeah, there is plenty of it to engage on, I would think, as you as members, but you may have indeed some questions. You can post them in the chat box, but you're also free to raise your hand and then we take the floor. That's perfectly fine. I myself be not in a position to see hands coming up, but Maria, you probably can see them and then you can indicate if there's someone who wants to speak up or say something. I was just thinking about your call for topics for potential webinars. I think because that's is really something which is really promising. We can quite easily, we have the machinery now to get it moving quite quickly without too much effort from our side. We help HSD to technically to do it, to run those webinars. And I think we are working on some great examples where people do come up with proposals. We can suggest maybe 1 or 2 adaptations or putting a global aspect to it. And then, we have all those numbers where we can post it to and others. So if you are interested, I've seen quickly, if I looked at the range of members which are present today, I can clearly see some of you are even someone in a real hotspot. I hope you're fine. But we know who I mean, but there's also others who are related or inside some fragile contexts which are kind of forgotten these days. And I think it's also up to us, I think, to keep asking attention for those areas, and not only the ones who are featuring so highly in the news.
Indeed. So any thoughts and ideas are very welcome. I can see Egbert comment from Juliana Bo. That about a session on evaluating health systems and strengthening approaches and outcomes. Juliana, do you want to say more about that? Are you thinking of organizing something on that from others, or yourself? Your team is working on that. Can you say a bit more?
Yes. I'm currently working on health system strengthening in South Sudan, which has been happening. I would say the current approach has been since 2012. So we have about 10 years worth of a health system strengthening approach that I think having a proper evaluation that looks at not just the outcomes or increasing the number of people going to the health facility, but what are the transactional costs? So we have a model that relies on international NGOs to strengthen the government system and processes. And we kind of have the higher numbers, how much money has been invested by the World Bank, by USAID, by whatever, but we don't really have a cost effectiveness analysis on whether or not this approach actually enables us to reach the particular outcomes we're hoping for. And what does it mean to actually strengthen the system? Is it the workforce? Is it the infrastructure, the pharmaceuticals, etc.? And I think having a broader, looking broadly at what health system strengthening actually means in practice is important to do. But I also understand that there are challenges in actually trying to access the money part piece of it. So we have the data piece of it, the number of people coming to the health facilities, the number of mothers, children, etc. But we don't have the cost, the costing piece of it. And I think those two are sort of tied in together. So I think that is sort of like the point I'm trying to make, but also what are the strategies to evaluate the system? Because I think it requires a different set of methodologies. And I think discussing that is important and critical. So that was my comment.
Thank you. Thank you. And definitely this is the type of discussion that we aim to have in that HSS working group. So obviously the question of how to measure HSS is the million-dollar question. So yes, it will be hard to have an answer, but it will be interesting to start thinking about it. And also, as you say, to start thinking about what is specific of HSS, health system strengthening in fragile setting. Obviously, it depends on how we define fragility, so that other work stream. But I think you're right, trying to understand, how it's done is, and what approaches are there and how they contribute to system strengthening at the same time to cost effectiveness and other objectives. That's particularly interesting. So yes, I'm gonna happy to continue this discussion in that working group. So yeah. I can see comments and I will read them out. So because I know Egbert is working.
I can see them now. So I will jump in for the next one. You catch up. Thank you very much, Juliana. That's a great suggestion, and we can have some more bilateral communication to develop this a bit more. In the meantime, I saw several interesting comments, and the one from, maybe we could give the floor to Isabelle Brémaud. You said you are currently developing a fragility analytics tool for health. And there was already one comment that is very interesting, and that this could potentially be very interesting. So could you explain a bit more about what you are developing?
Good morning, good afternoon. I'm Isabelle Brémaud. I'm working with the Momentum Integrated Health Resilience project funded by USAID, and we are in about 8 countries, fragile and conflict-affected countries in Africa. And so we are now entering the 4th year of the project. And we are still struggling, but we're coming to kind of an agreement on a fragility analytics specifically for health. So it looks at fragility as the different traditional aspects, but also with an additional aspect on health.
Sorry, we're losing you a little bit, Isabelle.
Okay, sorry.
Can't hear you anymore, unfortunately. Is that just me, or can anybody hear her?
No,
I can't hear her.
Lost her. Yeah.
Oh, sorry. Well, I can see a few comments on gender equity and social justice. That's a very, very important issue, obviously. And again, there's Claudia and Irene, perhaps you know each other, perhaps you don't, but we're happy to also make these connections and networking, and that's what the TWG is about. So please feel forward to message each other or go through us. And again, webinars are always a very good way of kind of sharing information, but also creating links between different research groups and different people. So feel free to use us as a platform to do that. We can help with like logistics of that. And Joanna, who's now in the background from HSG, is often helping us on that. And I think it's a great way to support this networking and the kind of links between the different members.
Yes, and I think the comment of Claudia and Irina about gender equity and social justice, of course, it does remember me at a presentation which Maria and Nigel and myself happened to be there in the audience last week. Was presentation from Val Percival from Canada. She is, but she was leading the Lancet Commission on health equity and gender equality, as she called it. And they have recently posted a major piece of work, which is, I think, very interesting, to combining those three topics: so health and equity, gender equality, and of course also then health and more peace building in general. So I think we may want to do something on that also in terms of webinar, but at least we will have posted the articles which from the Lancet in our upcoming newsletter, which you may receive next week.
I'm going to find the link and post it just now.
Yeah. Maybe in the meantime, Nigel, would you want to say a bit what you're proposing?
Yes, thanks, Egbert. So I was just thinking on the capacity building for health system strengthening, trying to look at the political aspects, because so many of the countries that we're all working and researching in, we're completely sort of victims really of the current political and security scenarios, and how that can put back any health system strengthening or drive it forward very rapidly. So I think it's spotting those opportunities and the really in-depth political economy analysis to work out where opportunities may be available. But also as health practitioners, how can we work with our national counterparts in countries to spot the political opportunities and to drive potential changes, so that when we look at this health system strengthening, capacity building, we don't just make it very functional around the building blocks, but we make it something much more fluid and much more political, because the big changes happen so often when there's major political changes. And to see can the health community have any influence over those changes, I think would be really interesting. Thanks.
Thank you, Nigel.
Yeah, and I think there was one comment to you, Nigel, by I think Juliana Ball. Maybe you want to explain a bit why you asked that question, because I can agree with you, and I already indicated we have still so far we have not done so much on capacity building, although it's a major theme for health systems global. They are really keen on that, but I think this discussion starts opening the debate on what do we actually mean, and at what levels should we do the capacity building.
I don't want to hog the line because I've spoken already, but Egbert, you've actually said it. I think we need to outline, and I think Nigel also said it, we need to outline what we mean by capacity building. I think it cannot happen outside of government, essentially. And so when we talk about capacity building, it's not just the building blocks themselves, but also the specific structures and institutions within the government that we need to focus on, that would actually help us get to the point where the health system is sustainable and there is a stewardship, proper stewardship of the government systems itself. So I think you all have said what I actually meant to say.
Yes, that's great. And I can see in very pragmatic terms, I can see a few key people kind of raising their interest in HSS and what it means. And so, yes, I will kind of take this interest as in, volunteering for that kind of like working group on HSS. And yeah, I'll reach out, Joanna, of course, and Nigel. And also, it seems to me there is a group of people interested in gender and equity and social justice, which is something that we didn't cover in our core topics, but obviously it's essential, and it could be the topic of a webinar, as I mentioned. So perhaps again we can link people, we can try and see if Val is interested, and obviously there is the Rebuild for Resilience, the project I work for, that is also working on that. Perhaps we can try and bring together some thinking around that in one of the talking points webinar. It doesn't have to be tomorrow, it can be in a few months down the line, but it will be interesting. So if you have any work that you would like to share, please reach out to us. That's definitely something that it seems to connect a few people and that is interested on that. So thank you for raising that point. I'm gonna check the comments quickly.
Yeah, and in the meantime, thanks, Isabel. I know you have to go to do some teaching, and but we will be in contact if you're still Still there. Yeah.
Thank you. Yes, thank you. Claudia? Hi there. Oh, we can't hear you. Can you unmute yourself?
Can you hear me? Sorry. Yeah. So no, just going back on the point of gender equity and social justice, perhaps just to share, I will share shortly whenever it's accepted, hopefully soon, a scoping review I made on health systems resilience in fragile and conflict affected settings, which was highlighting exactly how these aspects seems to be particularly prominent, and it's a feature that often is kind of neglected or overlooked in all the both theoretical and operational frameworks that are proposed for healthcare interventions in this context. And that could be probably a starting point, and I'd be happy to really work with whomever else is interested in the topic. So just pleased to know all of you have been following the work over the past few months, but I never had an opportunity to properly introduce myself.
I was just wondering, from a technical point of view, Joanna, can we save the chat somewhere? Can we have that? It's just, so I'm taking notes, but I also want to make sure that we have all this points, discussions, and names kind of saved somewhere. So if we can do that, that will be amazing. Thank you.
Yeah. No, that's simple. Yeah, thanks, Claudia, for those comments and making the the link now. That's great. Yeah. Is there anyone else who wants to contribute something? We don't necessarily have to use the full hours. We're all busy. But if there's anyone who wants to speak up or contribute something, then now's the time. But if not, that's fine. I think we had I think surprisingly a bit, because it was more difficult in the past, but I think you had some great contributions, some great ideas, and quite a few things to follow up on with several of you, if not all of you. So we will do so. What we will do briefly, we will have a very short kind of summary of this meeting, no details, of course, but in our newsletters. But if applicable, we definitely will contact you personally to see how we could develop some of the thoughts which are mentioned and how we could even connect better than we already do. So yeah, on behalf of TWG, and I'm sure Maria really want to close it, but thank you for your attendance. Thank you for your great contributions. I think it's really very good to hear how you're all engaged. We definitely have the feeling, well, we of course we do see the world, and we see that things are terrible in many countries and fragility is increasing, but we also see over the past year some major increase in work for us as researchers or practitioners who are directly involved in those countries, that there is much more interest in that type of work and develop some of the backgrounds what we do need to work in those environments. So thanks very much. And Maria, you want to do a final close?
Yes, again, thanks everybody for your contribution and your thoughts. I can see there's still some more, but I think we can keep them for one-to-one discussion. Sorry, Nadine has raised her hand.
Sorry, I won't be long. No, I just wanted to, sorry, because I'm new to the group, but I just wanted to find out, like, in terms of opinion articles on crises and conflict settings, how many have been published through the group so far, and on what platforms? Because I know it was mentioned that they've been published in the Lancet. But if you do have any that have been published through the group or any of the members, please can you kindly share them with me, so I can take a look. I'd really love to read them.
So in terms of communication, so obviously a lot of our members, as we said, are academics, so we tend to publish in journals, but we also publish blogs and reports, and there's a lot of practitioners who also want to share their experiences. So the best to do that, and where you can find most of them, is actually to have a look at our LinkedIn group. So in the LinkedIn group, you find what people post, whether it's a published paper or other type of output. And also you have the link there to our newsletters. And in the newsletters, we publish both work from members but also work that we think is generally relevant to the topic. So I think the best for you is to have a look at the LinkedIn group. And if you're not registered with the Google group, that's also a good source of information.
Okay, thank you so much.
No problem. And yes, and again, just to echo Egbert, thank you so much for joining us and for the lively discussion. It's great to have already a few ideas and also new names and networks and people that it's nice to be connected. So it makes our work a bit more interesting, because now it's not just those 2,000 members, but at least if you have a face and specific interest that we can talk to. So again, please remember that we're here, and we're here to help you to do your work and to disseminate it, and to make sure we all advocate for a better health system in fragile and conflict affected settings, and we share our knowledge and experience about that. Thank you very much.